Blue pinwheels are popping up all over the Lowcountry to mark National Child Abuse Prevention Month. At least 1 in 7 American children have experienced child abuse or neglect in the past year. Well, here to share how we can all be child advocates is Dr. John Melville, Chief of MUSC's Division of Child Abuse Pediatrics. And we're so glad that you're here to talk about such an important topic. When we hear 1 in 7 children, that's a lot of children, isn't it?
Unfortunately, it is.
It is. And so when we're talking about being an advocate, what is something critical to break the cycle to help children heal from such an experience?
So I think that before we get to healing, we'd like to prevent it if we can. And I think the children who are most resilient against child abuse are children that have an established, permanent, and supportive relationship with an adult. An adult who's interested in them, an adult who listens to them, an adult who believes them. After that, there are a few details. Kids need words that they're allowed to say for all the parts of their body. But what they really need is they need an adult who cares about them, and they know it.
Yeah. Because so often these children, they are abused at the hands of relatives, sometimes their parents, their own parents. A lot of people, and we've talked about this subject so many times before, but a lot of people are reticent to speak out because they feel that it's not their place, or they can't be too sure. They don't want to cause bigger problems by reporting something that in their mind maybe they think was overblown. So it's a very delicate subject as a third party. So what do you recommend for people to recognize signs and to act on that recognition?
I recognize if you're thinking it might be abuse, you need to talk to a professional. And in South Carolina, we have one phone number for the entire state. It's 888-CARE-FOR-US. That is the intake hub at the Department of Social Services. And I think the reason that reporting is the right way to do it is because it's so nuanced, because it's so delicate. When people have genuine concerns about physical abuse, there are a number of professionals who really need to be involved to make sure the child gets protected.
Sure, yeah. And what are the outcomes usually? So when someone does step in and they prevent future abuse from occurring, they stop a cycle, that child, a lot of times in the past, maybe they say that children are damaged goods at that point, but that's not true.
That's not true. That's a very common, and I'll acknowledge that there are some children who have very serious outcomes after various kinds of child maltreatment. But for the vast majority, especially for the children, where an adult steps up and says, I'm going to take care of this child, I'm going to make sure they get the right treatment, I'm going to make sure this doesn't happen again. For those children, the vast majority of them do very well. There are some very difficult problems, but we have established treatments that we know work. These are treatments that work over the course of weeks to months, not years and years and years. And then we don't see them anymore because they're not coming back to us. They're out doing kid things, and that's what they ought to be doing.
And that number, I want to make sure that we've got a couple of seconds left, but what was that number again?
It's 888-CARE, C-A-R-E, the digit for us.
For us. We'll put that up on the screen. Dr. Melville, thank you so much for joining us. It's been a pleasure.
Thank you for having me.
Thank you. We're back after this.